An update now on the measles outbreak hitting parts of the Lone Star State. Tonight, we're learning the number of cases in West Texas has risen to 90.
And doctors say being unvaccinated puts you at higher risk of catching the measles. KENS 5's Jeremy Baker reports there is a way to find out if you need the needle.
If you were vaccinated as a child, your immunity may have lessened. Now there's a test to determine your immunity and whether or not you should get a booster.
A lot of the time people get that vaccination when they're a kid, or if they've been exposed to the measles virus, they get that titer test to see if they have the antibodies to fight that and have immunity towards it.
The CDC says adults born before 1957 are considered to be immune to measles and mumps. Most adults born in 1957 or after who can't show they've had all three diseases, measles, mumps, and rubella, to get an MMR vaccine, whether they had one as a child or not. The CDC also says it's not harmful to get the MMR vaccine after being exposed to those diseases because doing so may prevent later disease.
Chari says AnyLabTestNow has seen an uptick in people wanting the antibody test because of the West Texas outbreak.
People come in and say, I saw on TV or I've read on the news that there's been an uptick, so I'm going to go ahead and come and do this titer test. And we absolutely encourage that.
Since I was born in 1976, I thought I would get the test and I'll get the results back through email in 24 to 72 hours.
You sign in, you fill out the paperwork, you sit down, and one of our phlebotomists who are highly trained and specialized in this field will draw your blood, and then we send it up for testing. It's an in and out 5-minute process.
For more about the MMR vaccine and to find out if you need it, we have a link to the CDC website about the vaccine with this story on KENS5.com. Jeremy Baker, KENS 5.